Hey guys, it's Hina Sheth here at Rebalance Physical Therapy, and I wanted to talk to you today about why men are having rectal pain, testicular pain, scrotal pain, and all other pains down there in the private area. Now, most physicians do not realize that there is a group of muscles that could be the culprit of why you guys and you men might be experiencing all these weird symptoms down in the saddle and private regions. And you may have gone to a urologist and they did a bunch of tests and they found that, there's no reason that you might be having this pain. They might have done a bunch of lab tests and found that, there's actually no bacteria or any type of virus or anything like that that's accounting for the pain that you have. And maybe they put you on a trial of antibiotics anyway for several weeks or months and nothing has changed. And so what might be happening is they might be missing the boat on a group of muscles called your pelvic floor that might be the culprit of your pain, and actually most likely the culprit of your pain. So I'm going to give you a little anatomy lesson here and then I'll tell you why. Now this is a female pelvic floor model, but surprisingly, the female anatomy and the male anatomy when it comes to these muscles is actually quite similar. So I don't want you to kind of get distracted that this isn't a male. So this is a model of the pelvis. Here is your iliac bones, okay, the two pelvic bones. They meet up in the front to form your pubic bone, and in the back, they connect to a triangular bone called your sacrum, which is right over here. Now, underneath, if you flip this pelvis down below, you can see that there's a group of red muscles that connect from the pubic bone all the way to the sit bones that you sit on and to the tailbone and to the sacrum. And this basically spans the saddle area that you sit on, okay? So you can imagine any type of pressure here is going to create pressure on these muscles. Now, what can happen, okay, for you males, okay, these muscles actually basically line the openings of this pelvis. So on a male, where, you would normally have, this is a female, so this would be a urethra, which is where you pee out of, and this is the vagina. But obviously for males, this would be where the penis would actually be, and then you have the rectum. So you can see if there's any problems in these muscles, okay, especially for males, if you're experiencing any type of pain, it's likely that these muscles could be really taut and these muscles are strained, and they could have taut bands, which are also known as trigger points, that could create pain in this area, rectum, scrotal, saddle area, and also refer pain into the sexual organs such as the testicles, the scrotum, the epididymis, areas like that. And what can happen is it can actually affect release of urine. So you might notice that you might have some urinary retention. You're having a hard time releasing urine. You may even have some constipation, have a hard time releasing and having a bowel movement. And then you also might experience all the pain that you feel. So oftentimes we hear it feels like there's a golf ball in my rectum, or there feels like there's something foreign in there, or I feel like I'm sitting on a golf ball. So those are just some of the symptoms. There's many, many more. You can also have abdominal pain. You might have bladder pain. You can feel like you're having a prostatitis, inflammation of the prostate, but it's not really the prostate. There's no true inflammation going on. So all of those symptoms could be a result of tightness in these muscles. Now, what do you do about it? Well, there's several things that you can do on your own, but ideally what you're going to need to do is see a specialized physical therapist that treats men and treats pelvic floor dysfunction and also knows how the pelvic floor is integrated into the pelvis, the hip, and the low back, as well as the mid back. Those areas are often areas that all need to be treated together in order to really treat this dysfunction. Now, if you live in the Philadelphia area, you can always call us. This is what we specialize in. And we are also on the main lines of Philadelphia. And we treat this, I would say, 90% of our day. Now, if you want some self-help tips, you can also go to our website. It's Rebalance orthopedic&Pelvic.com. And on there, we have some free reports on what you can start doing yourself to kind of help you with your pain. There's also lots of other videos. And you can also feel free to email us and let us know what's going on, and we can try and help point you in the right direction if we feel like we can't help you, or maybe direct you to a physical therapist in your area. So I hope this was helpful. And you know, if you're kind of going crazy trying to figure out what's going on, this is most likely what is going on. All right, guys. So take care. I hope you found this helpful, and have a great day.